Why strength training is a non-negotiable if you're a woman over the age of 30. Hi, I'm Kat. I'm a NASM certified personal trainer with almost 2 decades of experience, and I'm here to talk about the hormonal changes that do occur and impacts your muscle and ability to build strength. But I want to tell you, it's not all doom and gloom. There is still hope, especially if you have not started a strength training routine. So, hormonal changes start earlier than you think. Hormonal changes start in your 30s. Estrogen is a key hormone in muscle retention, recovery, and impacts your metabolism. So when it gradually begins to decline, it starts in our 30s. You start to feel some fluctuations, or maybe you don't start to feel it until after age 35. But estrogen takes a bigger dip in our 40s and 50s. So if you are in that 30 age time spot, that is a pretty good sweet spot for you to really integrate a strength training routine. If you're like, well, I'm in my 40s, is it too late? Absolutely not. All right. So muscle starts to decrease 3 to 8% per decade. May not sound like a lot, but when we hit menopause and our estrogen decreases even more rapidly. So if we're already in a state of decline prior to menopause and we're not doing anything to be proactive, our muscle starts to rapidly decline from there. The other thing is estrogen impacts our recovery. So when our estrogen starts to decrease, our recovery can take longer. It causes inflammation to stay in the body a little bit longer, leading to more soreness and fatigue. The other thing is with estrogen declining, fat distribution shifts. So lower estrogen can lead to more fat storage around the midsection. Okay, I don't want you to fret at this point, but strength training is huge for women. It helps preserve muscle mass. So whatever muscle you currently have on your body, if you're not engaged in strength training, or even if you are one engaged in a strength training routine, it is going to help preserve that. It is going to also help slow age-related muscle loss. It is going to also help increase in building lean mass, which is muscle. It is also going to help boost that metabolism. Muscle is a metabolically active tissue and organ in the body. So the more muscle you have, the better your metabolism is going to function. Now, I don't want you to think you have to be an overly muscled individual. That's not what we're going for here. You want to have good, strong muscles to maintain that lean body composition, which is going to help your metabolism function better. The other brilliant aspect is with the decline of estrogen in the body, your bones start to be impacted. Your joints and bones also are impacted. When we have a strength training routine in our daily life, it allows our bone density to be preserved. So the risk of osteoporosis starts to decline when we are actively strength training. Strength training also helps with blood sugar and energy. It improves, insulin sensitivity and stabilizes your energy. It also helps reduce risk of injury. So strength training and mobility helps prevent that joint pain, back pain, and injuries. All right, that's a lot right there. So what can you do now? Well, I want you to start engaging in 2 to 4 strength training sessions per week in a progressive overload. That means you're starting to build that strength and we want to increase that weight over time. So we want to think lifting heavy, 2 to 4 strength training sessions per week. So if you are not engaged in a strength training routine, start with 2 sessions and do it in a range, 1 to 2. So we build that consistency there. And then once you're consistent with 1 to 2 strength training sessions, move 2 to 3. Once you get consistent with 2 strength training sessions, and that third one is starting to be built in, bump it up to 3 to 4. So we want to build up. We can progressively build up with the strength training sessions in a week, as well as working on increasing the weight that we are lifting with. We want to prioritize that protein. Protein helps the body maintain and build muscle. It's about 0.7 to 1 gram of protein per body weight. We also really want to focus on that sleep and hydration and stress management. That helps support recovery, so we're feeling good in everyday life as well as in our workouts. In addition to that, move your body. Move outside of workouts, move outside of those walks. If you have a walking pad, get on that walking pad and move while you're doing some desk work. The bottom line is, if you want to feel strong, energized, and confident in your 30s, 40s, 50s, and beyond, strength training is a non-negotiable. The earlier you start, the better you're going to feel, and you're just going to have this great resilience body. If you're ready to get started, click the link below to try my 7-day trial or hop on a call with me. I'd be excited to talk to you and see if I could help you.